My name's Dr. Robert Coben. I'm a neuropsychologist. I practice in Fayetteville, Arkansas, where we run a practice where we see all sorts of patients for neuropsychological assessment, quantitative EEG, neurofeedback, and psychotherapy. And we also have a consulting practice where we work with other clinicians providing help with EEG analysis and supervision for their work. So neurofeedback is a type of brain training where you can train specific regions of the brain to get stronger, function better, and to help with controlling symptoms or just functioning better in everyday life.
Feedback.
Oh. So my first interest in neurofeedback came about 20 years ago, and I was working in a brain injury rehabilitation center. And one day I was searching for techniques that help people more than doing memory training or counseling or things like that, recover from brain injury. And I did an internet search at the time, ran across neurofeedback, thought it sounded really interesting, but yet sounded too good to be true. But anyway, went to a training session, got trained, started doing neurofeedback, learned from people, and have just improved and improved every second from there. So the earliest moment was probably the first teenager I ever worked with at the time with Asperger's disorder, who we worked with in neurofeedback, which was much simpler than what we do current days, but it worked really well for her. And it was the first time she basically could laugh with people and interact with people and have relationships. And she wound up 6 months later being on a tennis team and helping younger kids, and it was just such a great experience that when I knew there was something there that could benefit a lot of people. Oh, there's just so many that come to mind. We've had kids that have seizure disorders that basically their seizure disorders are treated and they don't have seizures anymore and they can live a healthy life. There's been people with strokes that recover their ability to speak and move. It just has a tremendous ability to help all sorts of people. So the way I would describe coherence training is brain training using neurofeedback, but focusing specifically on regions of the brain and how they connect to each other, how they talk and communicate with each other. And the idea is the better areas of the brain can communicate, the more effective we can be at regulating and controlling symptoms and problems and improving them. And coherence training is a very effective way to help people move towards those goals very quickly. Wow. So my first sort of learning in coherence was probably about 2002. And I've been doing it for the past 16 years. And we've been, as neuroscience has grown and our types of EEG analyses have grown, we've learned more effective ways at capturing that in EEGs as well as training that in doing neurofeedback. Yeah, so we have a model in our clinic where all of our patients have about an hour-long session, and about half of it is psychotherapy and half of it is neurofeedback, and we integrate the two together for every person that we see. Yeah, so we do work with a lot of people that are very sensitive and sensitive to being touched, which obviously is what we do in neurofeedback. So it really depends on the person. Some people are just sensitive and they can, deal with it and they can move on, and you just sort of approach them very slowly and ask them, is it okay if we do this? And usually their feedback is yes, of course, that's fine. There are other people that are much, much more sensitive and have a really hard time doing it. So we often work with them in a therapeutic sense and a behavioral sense to learn to tolerate touch. So for example, we can work with a very young autistic client to, maybe like wear a little hat on their head at home. And if they're able to do that for 15 minutes, their parents can reward them with a television show or something they like to do. And over time, they can learn to experience that touch sensation and be rewarded for it. And then when they come in to do the types of things we do, it's a little bit easier for them to adapt to that. Advice for people just wanting to start out in neurofeedback. So my advice is to find people that you know and you think you can trust in the field and you respect their work for whatever reason it attracts you in some way, and to get your initial training, but then to work with a mentor and someone who can supervise you and guide you along the path, because it is a lot of learning. And it's really helpful to have someone that you can work with who can teach you the right path to be as effective as you can be. So I've used EEGer probably since 2001. I first was trained on thought technology software in the 4-day training that I did. And then my mentor at the time used EEGer. And I just really liked the interface. And I liked the fact that it's very simple. The presentation to the client is simple. And there's a separate presentation to the therapist. And they don't have to interact with each other. They can be separated from each other. And it's just a really nice environment to work in. I think one of the things I would add is that there's a lot of sort of lack of knowledge about neurofeedback. And sometimes that lack of knowledge is taken to mean that it doesn't work or doesn't help people, when in fact it's very specialized knowledge to do something like this, and there's not a lot of people that have that or are exposed to that. But I think if you can find neurofeedback in your community and someone to work with that has experience, is probably one of the best treatments I've come across in about 30 years in the field of psychology and neuropsychology, and is really, really helpful for a lot of people. So I would encourage you, if you're a parent or if you're someone who wants it for yourself, to find a clinician, again, that you can trust, that can do an intake and an assessment and explain things to you. And I think once you go through that process, everything will make a lot more sense. And it's really not a whole lot different than going to physical therapy. Basically, you're doing therapy for your brain instead of your shoulder or your knee. And it can be really, really amazing, some of the success you can have with this.